But when you think about these different levels of resiliency, you can think about, okay, what have we learned from the COVID-19 experience and how might we apply that moving forward? And Jennifer talked about this. Certainly there's the resiliency, thinking about it environmentally, and our cities have never been cleaner. So I think as designers, and back with our partnership with public health and with policymakers and with government, I think we have to make a lot of noise about not letting this moment go to waste, and to be able to shine a light on this and to be able to go forward and recognize, look what we've achieved from this pandemic. So that's one takeaway of a type of resiliency. Another type of resiliency is a human resiliency. And I've been thinking about this a lot because, you know, it's just really tragic, the number of people that have died from COVID-19, but many, many more people have survived from it. And as a designer, thinking about how do we design for these people and families that are fighting for their lives, and the fear that a couple have already talked about that. And I think that's an interesting notion for a designer, thinking about the human resiliency of the patients and their families. And then, of course, you have to think about the human resiliency of the frontline clinical workers and what they're facing day in and day out. And even as designers today for hospitals, we think very much about our clinicians' burnout, but it's been front and center to us now about what they're experiencing every day. And it was even in an article in the New York Times this morning, and it was really, really tough reading about the nursing staff at NYU and what they're experiencing. So I think, again, as a designer, really taking to heart the kind of emotional, the support, the spiritual support, and actually the safety, and what Katie talked about, knowing where and what safety is. I feel that strongly as designers, that's a point that we have to learn.